My name is Lacey Gocher, and I'm an ASHP Medication Safety Scholar. I'm a P4 student at the University of Houston College of Pharmacy. The ASHP Medication Safety Scholars Foundation is for pharmacy students to learn about medication safety and educating the next generation of leadership. The ASHP Medication Safety Scholars was created by the ASHP Foundation and the Emily Jerry Foundation. I decided to create a video showcasing different professions of pharmacy and how we impact patient care and safe medication practices. In this video, my goal is to show that patient safety is not limited to a role or a job title, and that all pharmacy personnel have a role in creating the safest atmosphere for patients on a daily basis. In this video, I showed 10 different areas of pharmacy and how they practice medication safety daily. Each professional was asked how do they ensure patient safety in their daily role and why medication safety is important to them.
The way medication errors arise are multifaceted. Order entry, compounding, dispensing, administration, to name a few. Pharmacists and pharmacy technicians are involved in most of the processes and how medications get to the patients, whether inpatient or outpatient, and we can truly make a difference in really plugging those holes in the Swiss cheese model to prevent errors. I currently work as an integrated or decentralized pharmacist, which I empower with both clinical and staffing components and responsibilities that allow me to practice medication safety in multiple ways. On the staffing side of things, I am making sure that medication dosing is as safe as possible. This includes making sure patches have instructions on when or how to take off or when to replace, or making sure that pain scales have the appropriate pain scores. This also includes working with nurses on the floor to make sure that ambisome, for example, is ran with D5 or flushed with D5 and make sure it's not Y-sided with a saline, flush, or bolus that happen to be ordered at the same time. Clinically, I'm assisting hospitalists and other physicians with guideline-directed recommendations or communicating interventions based on patient status and how their clinical course develops over time. So really, pharmacists and technicians are essential and critical members of the healthcare team. We're truly the medication experts in the hospital setting, and again, the outpatient setting as well. And it's really our duty to contribute to medication safety and positive therapeutic outcomes while promoting a collaborative effort between professionals.
Oftentimes I receive the question, what I do in my day-to-day activities to help ensure patient safety. And when answering this question, I like to reflect on a book that has helped in my development throughout my career. It's titled The 7 Habits of Highly Effective People by Stephen Covey. And habit number 5, he states, seek first to understand, then to be understood. And when you translate this information, it involves some empathetic communication, understanding what drives individuals, what motivates individuals, what helps them get up day to day. And it differs for various individuals. And how I try to understand what's going on is by apprising myself of information involving medication safety. So not only do I review what's available on social media, but I take that information and translate it into knowledge to see what is worthwhile, what's affecting other individuals, organizations, as well as patients and individuals. Additionally, trying to understand what literature is out there from notable organizations, including ASHP, ISMP, nursing organizations, any event reports that are shared, so that as an organization, we can take those pearls, use them, and apply it to our organization as well. Additionally, I try to understand any information that is disseminated from not only accrediting bodies, but regulatory bodies. And by that, I mean looking at the FDA MedWatch reports, looking at the CMS reports that are out and about. This information is public at times, and so reviewing that, I can better understand the issues that are going on throughout the country, throughout the world, and then bringing that knowledge into our organization to help make it safer for our patients. And then last but not least, one of the items that I keep near and dear to myself is to understand the individual, what drives them, what motivates them, what led them down to a specific path and action. And by understanding that, we can better apply principles within the Just Culture mantra to assign appropriate accountability, but also making the organization a safer place. Why is medication safety important to me? I think it's best said in one statement. It's the right thing to do. Making sure that not only our patients are safe, but our employees are safe, and ultimately trying to make it a better place for everyone that receives healthcare.
As pharmacists and pharmacy technicians, we are privileged to take care of patients who are usually at their most vulnerable state, and this is a privilege that we should not take lightly. As we all know, one medication error could be fatal, so this is why medication safety must remain at the center of all that we do. One of the things that we emphasize in our pharmacy department is the importance of barcode scanning. This way, our staff are not only relying on themselves to ensure that they have achieved an accurate final product, but we have a system in place that will alert the user if they've scanned the wrong medication for the wrong patient. And so this is one of the ways that we work towards ensuring patient safety each and every day in our institution.
As an ambulatory care pharmacist, ensuring patient safety is the core of what we do. From performing complete medication histories, evaluating adherence, counseling patients on medications, adjusting medications to ensure both safety and efficacy, and working in an interdisciplinary fashion with the medical team at the clinic to manage chronic disease states, all encompass patient safety. All of those contribute to the patients taking their medications safely and managing their chronic conditions to improve long-term clinical outcomes. Medication safety is very important to me because it means that patients are receiving appropriate treatment that are not only safe, but effective so that they can get better, live longer, and be here for generations to come.
Hello, my name is Jacqueline Egwe. I'm currently the Quality, Safety, and Accreditation Coordinator here at Baptist Health, South Florida. There's a very basic human need to feel safe, and this goes on in our very day-to-day lives and carries on in all aspects of our life, including our workspace. I'd argue that medication safety is a very basic need that we have to provide to patients. And even though medication safety is a necessity that we have to provide, it doesn't mean that it comes natural for us. We recognize our incapability of perfection. This is why we have to leverage the systems that we have in place, guided by our expertise, and also rely on best practices from our colleagues all around the world with the same goal in mind, keeping our patients safe.
At Quorum, CVS Specialty Infusion Services, patient safety is our utmost important aspect that we take care of every day. Day in and day out, we ensure that we follow the USP 797 and USP 800 policies and procedures. By doing so, we can be sure that the medications being delivered in the patient home is free from antimicrobials and other things that can harm them while they're doing their infusion in the home. We are committed to ensuring the right care and therapy is delivered in the home. Thus, by reviewing medications being prescribed on discharge or other home medications, as well as herbal or complementary alternative medications, we will be able to make sure that all drug interactions are addressed and fixed before the patient starts on service. It is ultimately important here for us because, as you've heard in the past, home care really is self-care. Thus, the responsibility of the patient getting better on their home medication rests on their shoulders. And we here at Quorum help facilitate and equip patients with the right tools, medications, and needs in order for them to get better.
I'm Kathy Bricker, and I currently serve as the Quality and Compliance Coordinator for the Community and Specialty Pharmacies at Atrium Health Wake Forest Baptist in Winston-Salem, North Carolina. Medication safety is important to me because I firmly believe that to practice pharmacy is to practice medication safety. We are a profession to keep patients safe. Not only is medication safety right product, right dose, right time, right patient, it's ensuring that it's clinically appropriate, that it's cost judicious and accessible to the patient, and that the patient is going to be adherent. If all of these things don't fall into line, then the medication therapy isn't as safe as it can be. As someone who ensures our pharmacy's compliance with 3 different accrediting organizations and 3 sets of accreditation standards, I'm always on the lookout for opportunities for quality improvement projects. That's inclusive of safety initiatives. A quality improvement example in recent years in our community pharmacies involves the recognition that our community pharmacists were observing an inordinate amount of drug utilization review or DUR alerts during the prescription filling process, leading to DUR alert fatigue, which we know is an inherent safety risk. So we worked to identify which alerts were being observed that were clinically insignificant. We worked to reduce or eliminate those, and as a result, found that our pharmacists then were presented with 30% fewer alerts during the prescription filling process. Supporting medication safety in my role involves both proactive and reactive strategies. Fostering a healthy safety culture involves encouraging and overseeing our health system community pharmacies' reporting of medication errors and near misses. We want zero harm for our patients. If errors are reported, even if they don't leave the pharmacy, then we can address contributing factors to prevent it from happening again. In my role, working with 8 community pharmacies, we can use error reports from one location and proactively evaluate the rest of the pharmacies for prevention strategies. Another example of proactive safety strategies is our use of the best practice recommendations regularly published by the Institute for Safe Medication Practices, or ISMP. This organization provides actual or potential error examples and suggested methods for improvement and prevention. So not only do we evaluate whether we have gaps or opportunities in our processes, we also look for opportunities where we can be congruent across our pharmacies. If you work in 8 different pharmacies and they each have their own way of doing the same thing, then inherently that can lead to error. So we look for ways to be congruent where it makes most sense. While I don't directly dispense drugs or interact with patients, I do directly impact patient care by ensuring the medication use process is safe and appropriate for all.
As a pharmacy intern in the community setting, I'm able to do a lot of things that the pharmacist can do, such as counseling or taking new scripts over the phone. So ways that I practice med safety is when I am getting a new script, I just make sure that I get a playback. So I'm making sure that I write down the right drug, the right strength, the right sig, and then have any clarification that I need from the doctor, I'll just make sure to ask for them. And then also sending a patient home, I make sure to counsel them so that they're taking the medication correctly, and that will hopefully prevent any adverse effects or negative events from happening.
In my day-to-day operations, I have overseen the implementation of a central fill and mail order facility, and I'm also overseeing a new implementation at my new position here at Legacy Community Health. And I think the biggest challenge for us is a mail order home delivery service really exploded with COVID, and it was necessary to ramp up very quickly. And part of that process was, are we analyzing our processes quickly and efficiently to make sure that we're really taking care of our patients and making sure we're getting medications to them safely, not just in a timely manner. One of the challenges we had initially with our staff was they didn't see the mail as a patient. You know, on a day-to-day in a retail setting, the patient comes to the window, you get to see them, you get to interact with them. In the setting we have with mail order, we don't necessarily have that face-to-face interaction. However, we still have a responsibility to make sure we get those medications to those patients safely and effectively. So some of it was training of our staff and making them understand that every bag was a patient, even though you're not necessarily seeing them face-to-face. They could be your mom, they could be your grandfather, they could be your grandmother, and making sure we had that focus, just as we did in a retail setting, to be able to get things taken care of and make sure we get things out effectively. The other challenges came that we're using outside vendors to deliver these prescriptions. It could be FedEx, it could be the US Postal Service. So how do we do our best to ensure we have medication delivered on time at the right temperature for something that may be refrigerated, and looking at those processes. So we did a lot of testing with monitors that we sent out to different locations throughout Harris County and throughout Houston to see if the temperature held and how long the temperature held, to make sure that we could realistically mail these prescriptions and still get them to the patient in the proper temperature. We also looked at our insulins and some of our high dollar meds, and we looked at what the excursion time could be and made decisions on maybe we only dispense a 30-day supply of certain medications to ensure that the patient was able to get the medication and it was still effective and still did everything that we needed to do. The last piece was just to constantly look at the different opportunities and look at our different workflows and make sure we were assessing them regularly. There were several things where we thought this process would go smoothly. We had a hiccup, go back, do an analysis. In some cases, as far as going to an FMEA to establish where our gaps in potential workflow were and how we could correct those, be it through system or be it through training or changes in our workflows. So that's kind of what we've done with mail order as far as trying to tighten up our system and once again, bring the staff along with us. I think it's important that it's a collaboration. You can have the best workflow process in place, but if you don't have your staff on board, your technicians, your pharmacists, and everyone understands what the goal is and the importance of what we do, then you're going to have issues and you're going to fail. So you have to bring the team together and make sure everyone's on the same page. For me personally, I think medication safety goes back to, it's hard to say this, 20 years ago, when there was an oath of pharmacist that was taken when I left pharmacy school that stated, we will take care of those patients and we will look out for them. And their care, their optimum care is the most important thing for us. That to me has rung true since the day I started when I was the retail pharmacist 20 some odd years ago, verifying that first prescription and waking up in the middle of the night saying, oh, did I get that right? Was that the right dose? Was that the right sig? So for me, I think it all comes back to that. It all comes back to that promise and that responsibility we took on by leaving pharmacy school and moving on to say every patient is our responsibility. Every patient's outcome is the responsibility of what we do and how we do it. So we have to take it to heart, and it's got to be at the center of everything we do. And if we don't do that, then we're doing it injustice to the patient, but we're also doing injustice to our profession. There's a reason that we're one of the most trusted professionals in the entire world, and especially one of the most trusted health professionals in the entire world. It's up to us to keep medication safety in mind, keep it at the top of our mindset, and make sure that we are doing justice to our patients and making sure they get the best outcome possible.
Hi, my name is Payson Ashmead, and I am a pharmacy student and intern at the University of Utah. In my role as a pharmacy intern at the hospital I work at, I have the great opportunity to do medication reconciliation for the patients that are admitted. I view this responsibility really seriously. This transition of care is oftentimes very complex, and a lot can go wrong. Wrong medications can be restarted from home doses that were incorrectly noted in the chart, and we see frequently that the home medications that patients take are often inappropriate or dosed incorrectly. In my experience, as I do each medication reconciliation for these patients, I always find at least one thing, even if it's small, that I can correct and make this experience in the hospital just a little bit safer for our patients. Medication safety is probably our profession's number one priority. If a patient isn't safe while under our supervision, then I think we've failed. And so each of us, no matter our role in the healthcare system, no matter our position, can do a lot of good in impacting the safety of our patients by just working and improving the processes and practices where we stand. I think if we don't do this, then we haven't really fulfilled our promise to our patients as pharmacists in making sure, yes, they have effective therapy, but also that it's safe.